Will insurance cover bariatric surgery? The question really depends on the insurance plan. Most patients are often confused by this topic, and it's because the insurance companies do tend to make it very confusing. It really depends on the plan. And this is a scenario where it's either a yes or a no. If you're in the yes category, it highly depends on how heavy you are and what your other illnesses are. If it's a no, it's a hard no from the insurance company. They basically state you don't have bariatric benefits, and no matter what, we will not cover the surgery. Patients often ask, they say I don't have benefits, but what if I tell them I have this, this, or that? Does that get me coverage? And unfortunately, if it's a no, they're not going to cover it no matter what your other illnesses are. Now, on the flip side, if you do have benefits, then yes, by all means, you're covered by your insurance plan. Patients more often do have coverage for bariatric surgery than the ones that don't have coverage. If you're considering it, I would not make an assumption that my insurance doesn't cover it. I would definitely call my insurance provider and ask if I have bariatric surgery benefits. Now, what are the requirements of insurance companies? There's Medicare requirements, and a lot of times the insurance companies base their recommendations on Medicare requirements, but not always. It's a little too much to get into right now, and I don't know each particular insurance plan that you have, so we can't really go into each one. But as a general statement, most insurance companies will cover standard Medicare requirements. So there's requirements out there right now by Medicare, and those are based on whether you have illnesses associated with obesity and your BMI, meaning your body mass index or your weight. Obesity is separated into three categories of obesity. There's class 1, 2, or 3, and that's based on your BMI. So your BMI between 30 and 35 is class 1, 35 to 40 is considered class 2, and greater than 40 BMI is considered class 3. And so newer recommendations from the American Society of Metabolic and Bariatric Surgery, which is the United States society that oversees bariatric surgery and makes recommendations on the behalf of the doctors or the surgeons. They've come out with new recommendations now, and that has lowered the threshold to recommend surgery for patients. So the current recommendations that have just come out in the past year or two are patients that have class 1 obesity, so a BMI over 30 would need to have some kind of another illness from obesity. Usually that'd be diabetes, hypertension, or sleep apnea. And then with a BMI over 35, which is class 2 obesity, no longer is it the society's recommendation that you're required to have an illness to be covered for surgery. Medicare and the insurance companies are oftentimes a little bit slower to catch up with the recommendations. And so the general insurance recommendations generally are if your BMI is class 2 or BMI over 35 with comorbidities or illnesses such as diabetes, hypertension, sleep apnea, then most of the time they'll cover it. Once your BMI is class 3 or over 40 for a BMI, then they usually say, okay, that they'll cover it without the other illnesses being required. And again, you can't take that to say all insurance companies because each one has their particular requirements, but you can use that as a general guide of what they're recommending. If you have any questions about insurance coverage, please feel free to reach out to our office or subscribe to our channel.